Good afternoon, everyone. Thank you for joining us for today's webinar presented by Mary Bartlett, President of SafeLink, and Gary Morgan, Vice President of SafeLink. Mary and Gary, thank you so much for being here with us today and providing this excellent presentation. And at this point, I will pass it off to the two of you.
Hey, thank you so much, Caitlin. And of course, this is Mary Bartlett. And as President of SafeLink, it's so exciting to announce that we're now offering our products and services through Zahn. We know these are difficult and challenging times for dental laboratory owners, and Zahn is truly committed to supporting your efforts to resume your business. For those of you who are not familiar with SafeLink Consulting, we have been providing the dental community with employee health and safety products and services since 1991. And in 2003, we added FDA compliance, and as a part of that is the development of your quality management systems. Our clients partner with us on compliance issues because of our dental industry specific expertise and the strength of our people and our support structure. So we consider ourselves the premier provider of these products and services to dental laboratories, and hope that you'll give us the opportunity to help you assess your risk, plus enhance your current safety and quality programs. So our approach is to provide customized solutions, and that's through in-depth discovery focused on our clients' needs. So we find that each business is unique, and therefore it's best to develop programs that are specific to your business model and to your needs. Also, as far as health and safety, OSHA has state plans in 28 states and territories, so we consider those state requirements as well when we help you develop your safety programs if you're in one of those states. So our consultants have extensive background and experience in understanding and working through governmental regulations so that they can apply those regulations to the laboratory industry. Our knowledgeable and well-trained support staff is committed to bringing the best solution to each of our clients. So together, our staff and consultants work really hard to foster a solid relationship with each client. So why do Zahn customers need SafeLink's services now? Well, this is a time like no other for most business owners. COVID-19 has changed the way we do business and the way we provide a safe workplace for our employees. We can assist you in resuming business safely during this pandemic and also help you understand how to protect your employees and their families, plus if you have patients coming into your lab and any visitors. So you will be working with safety experts who are familiar with the dental laboratory and how COVID-19 affects the dental lab operations. Every day we're working with our clients to keep them abreast of how to handle internal and external risks that are being created by this pandemic. So it's important for you to be proactive in your approach to create policies for managing COVID-19 issues so that your employees know up front what to expect when they come to work, or if you happen to be faced with a COVID-19 exposure incident. Some of the most important policies right now would include pre-screening, your on-site screening, and your return to work criteria. So we can help you meet OSHA compliance requirements, not only in general, but as they specifically relate to COVID-19. Our goal is to help you reduce your lab's risk and liability by providing you with products and services that are specific to your business operations. So this slide shows you a list of our products and services that are available to dental laboratory owners. We have virtual services such as virtual training, those are live webinars, and virtual assessments. This would be similar to our on-site walkthroughs for safety surveys. Also, we have a very specific COVID safety management program. We provide health and safety manuals, and those manuals do now include the COVID-19 policies. We also provide on-site safety services. We have hourly and retainer consulting. Also, through our website, you'll find online educational courses, and they do provide CE credits. Also, our quality system for FDA compliance. So now to go over these with you and explain more about why you need these products, I'm going to introduce Gary Morgan. And so he will discuss the services and the products that are available to you through Zahn. Gary?
Thank you, Mary. So we are thrilled, as Mary said, to be able to partner with Zahn to be able to provide you with access to these different products that we're going to talk about, um, and how these are offered, and some pricing information as well on the products. So the first one we're going to talk about is the virtual safety training. This particular product is a way to provide a customized training program for your dental lab. That's one of the requirements that OSHA has, is that you do training. A lot of the times in the past, we've been doing these on site. So we would go on site, do the safety training. But because of the situation that's occurring right now because of the pandemic, and then also just being able to offer it in a way that is conscientious of the costs, we are now offering this virtual safety training. So this particular product, the benefits of it is that it will recognize the most common safety and health hazards and how to adapt those and address those with your employees. As Mary stated, we have a very long experience with the dental laboratory business model, because that's what we started in, was OSHA compliance for dental labs. Um, I'm a certified dental laboratory technician myself, have been in the business for a very long time. Others of our trainers also have dental lab backgrounds. So we are very specific. We understand the issues that can occur in a dental laboratory. So that's one of the benefits, is we know what kind of safety and health hazards exist in a dental laboratory, from its beginning all the way up now through this unfortunately COVID-19 pandemic. What this virtual training session also does is it meets OSHA's annual training requirements. I think a benefit of that is being able to say you have the training program that can be customized for your particular dental lab provided to your employees. Therefore, you meet that annual requirement for providing this training, and there's no better time to do this than now, because you're returning back into work. It's a good idea to get that safety training taken care of, and also include in that safety training some of the specific health hazards that exist now because of the COVID-19 pandemic. It's delivered in a method that really creates better acceptance by employees. It ensures that they retain that knowledge. It brings very positive results. So it is customized, in meaning that we will discuss with the employer of the lab beforehand the information that we will be presenting in that um, virtual training session. It's delivered contactless in the comfort of the lab's environment. So that is a benefit. You can do it, schedule it with us whenever you want to, that works best for your team, to ensure that everybody can sit in the comfort of the lab environment. And then even also, if they need to be remote, we can also look at having them do that in a remote situation. That's critical, I think, right now because of the social distancing. You don't want to get too many people in a training room to sit down and watch this. So you can spread people out. They can access it through multiple monitors or computers so that they can still be safe and not put each other at risk. It usually is a 1 to 1.5 hour session. And that session provides CE credit for those individuals that need it. So for CDTs, they would get the regulatory standard credit that they need to get every year. So that's a benefit of it. They don't have to travel to get that CE credit. We provide all of the training documentation for it. So that ensures that should you ever be audited by OSHA, you can show that you have those training records for the training session. The other benefit for it, which I think is really important, is that it is recorded as we present it live, and then that's made available online for 2 weeks following the presentation. So what that does is for those individuals that cannot be present at the time that you want to do it live, maybe they have a schedule change or something that pops up very quickly and they can't be there, you're still going to be able to use the same training session for those individuals. So it makes it all standardized, still customized for your particular situation. In this virtual safety training, we include all of the following topics as they specifically apply to your lab environment. So we would cover the bloodborne pathogens area. That's required, the exposure control, infection control programs, not only for the bloodborne pathogens that we've all been familiar with over the last few years, but then we would also very specifically address COVID-19 in this particular part of the training, because there are some different risks, hazards of this particular virus that need to be addressed a little differently maybe, or more specifically than bloodborne pathogens. We would also then cover the COVID-19 infectious disease preparedness and response plan. So this is a very specific program addressed at this particular virus and how it impacts your laboratory and how its business model may be affected by it, including return to work, as Mary said, those specific issues. We would also cover chemical safety, hazard communication. One of the biggest areas and probably one of the hardest for those individuals that have to do training is to cover this properly. So it would cover all of the hazard communication requirements, including labeling, including safety data sheets. All of that information would be in the chemical safety side of it. We would review the emergency planning for your particular work environment and the procedures specific to your laboratory. So we could cover, exit strategies. We could look at the different assets, the availability of those assets, how to use those assets. So providing that training is very critical for any emergency that could occur in your lab. We would also then go over the personal protective equipment requirements. This is really important because each lab may be different. Your lab may require certain kinds of PPE be worn in situations where another lab might not. So that's where we customize and make sure that we're presenting exactly what the policies and procedure requirements are for your particular environment. Ergonomics is one of those areas that, while there's no specific standard in OSHA's regulations, it is one of the areas that is more common where we see these workplace injuries, so musculoskeletal disorders becoming more abundant, being reported, the work environment. So we really work on working with the lab to analyze the ergonomic situations and present education in the virtual safety training as to how to recognize those concerns and issues. Electrical issues would be covered, and lockout, tagout, which is probably one of the areas that very few labs are familiar with if they haven't done it before. So we would cover the requirements for lockout, tagout. Equipment safety is another area that's very important, how to work with the equipment properly. And unfortunately, workplace violence, because there are so many issues with workplace violence right now, having the information and the training available to identify, address, de-escalate any issues there. And then we also cover injury and illness reporting, which dental laboratories now have to do to make sure that we do the correct recording and reporting of workplace injuries and illnesses, and to know when to do that. The second program that we're offering or highlighting in this presentation is the virtual safety assessment. So this is done through the use of technology. We now have the capability to do a virtual walkthrough and assessment of the dental laboratory, doing it remotely, where in the past we've come on site and performed this assessment. Now we can do this through this virtual assessment. The fee for this is based on the square footage of the lab, so the physical size of the facility, and the time to conduct the assessment and prepare the written assessment. So you would get a written report on this. So this starts at $595 and then goes up from there based on that particular square footage of the facility. The benefits of this is that it helps determine the lab's risk position and prevention needs, because what we would do is, through the use of some platform, technology platform, either FaceTime or GoToMeeting, we could do Skype. There's a lot of different ways to provide this virtual safety assessment using the technology that's available in the lab. We would do that walkthrough of the facility and look at the risk position and identify any prevention needs. It does review the OSHA compliance requirements. We also look at the CDC guidelines, for the Center for Disease Control guidelines for infection control. It is an interactive access to an expert familiar with the dental lab practices, the safety practices, the work environment. The benefit of that is that now we can communicate back and forth. So during the virtual assessment, we can talk about the issues specific. It's done with whomever wants to do the walkthrough with us, whether it's the laboratory owner or the OSHA compliance person for that facility. But we can then communicate during this process and look at what are the risks, what are the practices in place, identify anything that we think needs to be addressed. The main benefit of this is very economical, effective. It's delivered contactless again. What you're looking at here, there's no travel costs. Having one of our consultants actually visit the facility to do the walkthrough can raise the cost of that. It is a better way because to do it actually on site. However, with this, the risk right now, for us even, this is more effective. It protects everybody from exposure, and then we're able to do this on your own time. So we can schedule it whenever's most effective for you to do this. We again provide a detailed written report of the prevention needs, identifying those areas that we think need improvement, seeing what could be addressed from a safety standpoint. In this virtual safety assessment, basically it is an interactive safety checkup, and it does include all of those following guidelines and requirements. So really right now, COVID-19 is on everybody's mind. So return to work policies would be covered. It would also look at the infection control practices and procedures for bloodborne pathogens, but then also including COVID-19, seeing what we're actually doing in the lab. Are there areas where we could improve to ensure that employees are not put at risk? Looking at the personal protective equipment requirements, including respirators. This is one area that's probably difficult for the dental lab environment to put their arms around. When do we need certain kinds of PPE? When should I require it? And we can look at that at the virtual safety assessment and see if you have engineering controls in place that maybe preclude having to wear PPE, or if we don't have those controls in place, when that PPE would be required. The bloodborne pathogen standard, reviewing the activities, as we said, for infection control for bloodborne pathogens in combination with the infection control practices for COVID-19. These would cover the hepatitis B vaccination requirements. We would look at the specific areas of risk in the laboratory, the activities where the bloodborne pathogen standard would come into play. We would review the written health and safety policies that are in place for the facility and see how they compare to the requirements from OSHA. Make some recommendations to either improve or address those safety policies if they're in place. If they're not, then again, we could look at providing a product that could meet those needs of documentation of those written health and safety policies. We talked about the ergonomics issues. We can actually see how the employees interact with their work environment to see if there are some issues there that could cause maybe some musculoskeletal disorders to present themselves because of the work habits. Looking at the mechanical safety side of it, we look at the individual pieces of equipment, see if we have guards or shields, if there are any risks associated with working with that particular piece of equipment. From the fire and electrical safety side, obviously looking at what are the risks for fire. Most dental laboratories are very concerned about fires. We have sources for fires available in the lab. So we want to look at how do we prevent those from happening? What are the best practices? Electrical safety is a big component of that. The lockout tagout part of it as well. We would then look at first aid and emergency procedures and the assets to address those. So do we have first aid kits available? Where are they located? We could look at the location of assets like fire extinguishers, fire blankets. All of those could be addressed through this virtual safety assessment. Fire exits as well. Are they lighted? All of that could be reviewed through this virtual assessment. From the chemical safety side, looking at do we have a hazard communication program? Are we labeling products to let employees know that they are potentially hazardous? Are we storing them properly? Do we have safety data sheets available for those hazardous chemicals? This is a very broad area, and it's one that's a little bit harder to get everybody to comply with. So I think this is an area that gets cited fairly frequently. So it's one that we would really focus on. As we mentioned, equipment and machine guarding. Do we have the shields? Do we have the guards in the appropriate places? Even walking and working surfaces. What a lot of people don't think about is, do we have access to exits that's not blocked by anything? Do we have safe ladders? Are we storing those things properly? What do we do if floors get wet? So those areas we would look at. And as I mentioned, we would review that injury and illness record keeping requirement. The next product we're going to talk about is very specific to COVID-19. So this is the safety management program addressing that particular issue. It would be addressing the protection of workers in the facility, their families, visitors, anybody that might be coming into the lab. OSHA has encouraged businesses to develop an infectious disease preparedness and response plan. So that is part of this safety management program. It does include 1 hour of consulting for guidance on this particular area, which I think is really important, having the ability to interact with a consultant. If you have safety issues, if you have certain exposure incidents, things that you want to discuss as part of this management program of putting it in place, it's the what do I do situation. It also then includes all of the written documentation of this specific safety management program. And there's quite a lot of documents that can be included in this particular program. So the written documentation that's included is the infectious disease preparedness and response plan that I just mentioned. Included in it is a return to work policy. These are customizable, so they're Word documents that the employer can look at. If you need to tweak some of them, you can do that to make it your specific return to work policies. It has patient screening forms. This would be for any patient that needs to come to the laboratory, say for a shade verification, maybe it's for some other activity, even a visitor, you have a salesperson, your Zahn rep coming in, then you would also want to be looking at screening, and it has places to capture temperatures, you can ask questions. So these are all in those forms. Again, you can add to that document if you have other information that you want to capture. The employee screening form. So hopefully everybody is screening employees as they come back into the lab on a daily basis, even capturing that information so you can understand what the situation is with each employee, assessing whether or not they've had exposures, potential exposures, if they are not feeling well, if they have a temperature, so you can capture that information on the screening form. And then developing what that screening policy is for employees. So what you are allowed to do, what you're going to do with employees as they come back in. So taking their temperature, asking them screening questions, um, making sure that you understand what those risks are so that we don't bring, hopefully, do not bring COVID-19 into the laboratory at all. So that's a very important part of this infectious disease preparedness and response plan. And then it's to identify the personal protective equipment policy by task. So we can identify certain tasks in the lab or even outside the lab that employees may have a higher risk of exposure to COVID-19, and we need to address that. So looking at those individuals that go and do pickup and delivery, so our drivers, those individuals that would greet visitors into the laboratory, so front office staff, those individuals that would engage with a patient, say, to do those shade verifications. Also, for those individuals that may be tasked with going to a dental practice and doing some kind of consulting, immediate chairside conversions, those individuals do have a higher risk, and there then should be the development of PPE requirements specific for those particular tasks. And so this would be that PPE policy by task. It does have a hazard assessment component to it. So identifying the hazards of COVID-19 where those exist, and this is something OSHA is really keen on, is having the employer identify where those hazards exist and then addressing those, how they're going to control them or how to protect employees in that situation. Identifying the levels of exposure to COVID-19. So as we said, there may be those individuals that are at higher risk of exposure because of their activities, but it goes all the way through the entire facility, looking at what tasks, even internally in the lab, may elevate a risk of exposure. And then there are some safety actions for resuming your dental operations or your lab operations. So many of you have already gone back to work, full blown. Others are just now really starting to get back into activity. So the safety actions for resuming your dental operations would be included. How do I look at my lab differently? What do I have in place? Do I need to be putting certain things in place? And that may be, again, do I have social distancing? Can I do social distancing? Do I need to put in certain assets to address that to keep my employees safe in the workplace? And then one of the most important components of this is a template for a respiratory protection program when respirators are required. We've had a lot of contact with dental practices specifically on this because of the risks that they have in generating aerosols in their dental practice and what that looks like from a risk uh, standpoint, and then how to address it with uh, the required respiratory protection when respirators are required. Most dental laboratories in the past have not had to require respirators, and you may not need to require those even now in the dental laboratory for COVID-19 safety. But certain tasks, specifically one that I would cover would be that chairside services area, because if a dental technician is asked to go into the dental practice and be chairside during a surgery or offering other immediate conversions, assets right there, then it may require that that individual be required to wear a respirator, an N95. So in this particular uh, template, then we have that respiratory protection program, which includes then the medical questionnaire to ensure that the employee is medically qualified to wear the respirator. It would also have the fit testing criteria um, for that, so that every respirator that an employee is required to wear would be fit tested to make sure that it seals up. It also includes the evaluation of the availability of these N95 respirators. Because of the shortage we have, in the supplies. um, OSHA does want you to document, have you made those attempts? Have you tried to access those respirators? Have you tried to access the fit testing? And have you documented it? That's the biggest thing. Um, in all of this, one of the key words you're going to see is document. So this entire safety management program contains a lot of documentation that probably most labs have not thought about as they return to work. So I think this is one of the most important programs that any laboratory really needs to have in place right now. And then we also provide a resource links component to this. So basically links to different assets from the CDC, from OSHA, from the ADA, from a lot of different sources to get information. So education is a very key component of this COVID-19 safety management program. So another featured program that we have that you can obtain through Zahn is the electronic DIY health and safety manual. So the electronic DIY health and safety manual, it's an easy to use, self-directed and self-paced program. So basically it's an affordable way to develop your own custom designed workplace safety program. It's a simple, easy to use program that you just follow the instructions. You have the training tools there that helps you complete your own health and safety manual. So for a cost-effective program, I think this is one for $295. It will get you that um, health and safety manual that OSHA would require all of those written documents. So it is up-to-date content and includes all of the written documentation that OSHA would expect a dental laboratory employer to have in place. It is available for the federal OSHA plan and then those specific state components where there are specific state plan requirements. It would be delivered in a downloadable format, so electronic, which is great because then you have those documents available in a soft copy where if there's changes you need to make, you can edit those and keep this documentation up to date at all times, which is really key because a lot of facilities buy a health and safety manual, put it on the shelf and never address it again, and it does need to be kept current at all times. Then we also have the customized health and safety manual. So if this is really for a lab that says, look, I want it delivered to me done, completed. So this is customized to the dental lab's specific programs, policies, procedures. It features the most up-to-date info available to us addressing the health and safety hazards. It does include federal and state OSHA required documentation, and we do provide 1 hour of consulting to assist in that manual preparation. So if you get hung up, you don't know what something means, or you need guidance in how to make sure that it's done properly, then we will give you that 1 hour to do that. It is available in a downloadable electronic format, so the $5.95 for the federal OSHA. A hard copy manual, which means we present it to you in a binder. Everything's put in place, customized, and that's $9.95 for the federal OSHA plan. It does come with the electronic format so that you can make future amendments or revisions to those documents as needed. If you are in one of the states mentioned here, then there's a state-specific plan that is an additional $100 because those states do require very specific documentation to meet their requirements. So the customized health and safety manual would have all of these different components in it. The compliance programs that would address that infectious disease preparedness and response plan that we've talked about before in the COVID-19 specific area. It would have the chemical safety, hazard communication component, exposure control or infection control, all of the safety procedures, the assessments to determine what those safety procedures are, lockout, tagout, including all of the forms and documents that you would need to record that information. The personal protective equipment program, including the assessment, when to determine uh, when it's required and when it's voluntary. In your emergency action planning, how to identify the components of the emergency plan, what kind of assets you need, gives you lists of those assets, how to document and you need to look at those particular assets on a schedule basis. It has that information for you. The respiratory protection program, which we talked about, and this does carry over. It's not just specific to COVID-19. So if you have hazardous materials where you implement mandatory respiratory protection or even voluntary, it goes into the description of those requirements. We've mentioned ergonomics before, so that would be here. Vehicle operators, so you do have drivers that would be put in risk just because they get behind the wheel of the vehicle for you. So it would cover those vehicle operator safety programs as well. Safety and health training, so it would have those components in it, how to do this, the safety training, what needs to be in the safety training, checklist, the documentation to record it. It goes into the injury and illness record keeping, also with the forms that are needed for that. Equipment maintenance and schedules for when you do equipment maintenance, noise monitoring. Very important right now is the silica exposure control plan, because that is one of the more dangerous chemicals that dental laboratories work with. We have now a very specific silica exposure control plan that would be customized for your facility. We mentioned walking and working surfaces, and then there's a lot more to it. So there, all of that, the programs in here would meet OSHA requirements, and these have been audited by OSHA, so we know that they are complete programs. So a customized health and safety manual is one of the best ways to say, you know, you do it for me, I give you the information, and you have your manual in place. We do have offered through Zahn a combo offer. So this is the health and safety manual and the virtual safety training. So this component, if you put these two together, it saves you nearly $200. So this would be an electronic customized health and safety manual plus the virtual safety training. So This would be $1,395. This would be, again, delivered electronically. And then as far as the safety manual and then the virtual safety training, it does include the federal OSHA plan, again, the add-on for $100 for those 4 states that we mentioned. Hard copy customized health and safety manual and the virtual safety training would be $1,795. So now we do the hard work with the customized health and safety manual and then provide it in the binder, and you then get the virtual safety training. So these are great ways to get it all done, meet your OSHA requirements, and get them done in the best possible way with the least amount of work on your part. So I'm going to turn it back over to Mary and let her talk about this particular product and what is offered on this. So Mary, if you want to carry on.
Okay, thanks, Gary. We also offer through our website online courses. They are $75 each. We do have COVID-19 specific courses. As far as safety, we have some basic courses for a dental laboratory, specific to the dental laboratory. If you needed some training for new hires, many of our clients use those courses. As Gary had mentioned before, we do provide CE credits. So all of our courses do provide the NBC regulatory standards, CE credit. We also provide in Florida, they have special credits. We also are an AGD sponsor, so we provide AGD credits as well. So here's the website that you can go to. We have a video library. There's an index. You simply look at that list. It's separated by dental laboratories, and then you can watch the one. You don't have to watch them all at once. You can start and stop. And so this is another good way, since many people are still working remotely, or perhaps you want to watch these in the evening. So they're, whenever the time suits you, that's when you watch, and then we would file these credits for you. And so on the next slide, I wanted to mention to you that Zahn is offering a $75 gift certificate, and that is from Zahn. They have a laboratory recovery program. So you can go on the website and you can see the web address here. When you spend $500 on any combination of the Zahn products that are in this program, you will receive a $75 gift certificate towards SafeLink Consulting services. So the services, the products that Gary has gone over with you that we offer, you would be able to apply that $75 gift certificate toward our products and services. And they are limiting this to 1 per dental lab. So this is just another expression of Zahn's concern for you, wanting to help you. They realize how difficult this is for everyone, economically and in many other stressful ways. So this would be something that would help you at least pay for some of those products with us. So now we wanted to go to any questions, and I think Caitlin was going to be monitoring that to see if we needed to answer some questions.
Hi, Mary. Yep, I'm here. That was great, really informative. Thank you both. It actually looks like we did not have any questions come in, so very thorough presentation. So we don't have any direct questions to address, but I will just put out a reminder that if anybody does have additional questions, you can email us directly at zahn@henryschein.com. And additionally, we have a website built out, zahndental.com/SafeLink, where you can go directly to the site to view all of the detailed information about SafeLink and request more information there as well.
And Caitlin, as a follow-up, I just wanted to say how proud, as it states here, we are to partner with Zahn in serving the dental community. These are certainly challenging times for everyone, but we know how advantageous it is for dental lab owners to have this support right now, and we hope that those who've attended at least saw some of our SafeLink services and products that will help you manage your health and safety program. We certainly tried to be here for everyone during this COVID-19 pandemic, and the changes we're seeing, we're in a different phase now where we are helping our clients deal with people returning to work, helping them deal with exposure to COVID-19. And so as Gary went over that COVID-19 management program, I just can't stress enough how important it is for dental laboratory owners to be proactive, get these policies in place, understand what you need to do, because believe me, it happens, it's happening, and it happens very quickly when someone calls you and says that they have found out that they are COVID-19 positive or they're having symptoms. So that's when you want to be prepared, and we want to help you with that. So we do appreciate this time and look forward to serving you and working with Zahn.
Thank you so much, Mary and Gary. We really do appreciate it. The feeling is mutual. Again, great presentation, and thank you everyone for joining. Have a great rest of the day.